Hey everyone, welcome to the Powered by Iron Health podcast, where we are here to create a community that raises the standard of health and wellness. I've been doing PT now for about 10 years. I've seen a big change in the profession. Sadly, I'm seeing a lot of these PT companies get bought up, venture capitalists coming in, changing the entire healthcare world. So we're trying to deliver knowledge and show you what true healthcare should be or what good healthcare should be. So today specifically, we're talking about surgery and a PT's perspective on when you should be getting surgery versus when you should not. Now, I'll preface it with saying this is just my opinion. Take my opinion as what it is an opinion. Doesn't mean it's right, doesn't mean it's wrong. It's truly just my opinion from doing this for 10 plus years. So a lot of times, and I'll start with a story with a client I had one time come in, and he had back pain and lower back pain. And he had some pain down his leg. It wasn't that much. And I remember seeing him and seeing the fear in his eyes and just very fearful that this wasn't going to get better and the only way to solve it was surgery. It was a condition and something that I've seen multiple times in my career, and I knew and I had confidence that we can fix it without surgery. But he already made his mind up in his head that it wasn't going to get better without surgery, right? So what do you think ended up happening? We went down the path of trying to get him better, and he went to get surgery anyways. Even though we had some progress and we're getting the symptoms down, he still went to elect for the surgery. So there's something underlying there we'll talk about is you will get better based on what your beliefs are. So if you think that surgery is the only way, and that's the only way to fix what you have, you most likely will get surgery. So how do you counterbalance this? Be educated on your condition. Get multiple opinions before you do anything. And be open-minded. Like if you're closed-minded and saying this is the only way, then you're going to do that. Or like this is the only way that what's going to work, then you're going to do that. So that's the first layer. What is your mind saying? What are you saying about the conditions you have? And what are you verbalizing? And how are you feeling about it? Because that's going to dictate everything. Now, from my standpoint as a PT, there's a couple things right off the bat. You know, surgery, if you have really unrelenting pain that doesn't get better, like, you know, I would probably elect for surgery, and whatever the area may be. That's something to note. If pain does not get better over a 2-week period, you may be someone indicated for surgery, but that's like a rare thing that happens, right? For people who have a basic injury, let's say, for example, we're going to take the knee, and we'll talk specific about a meniscus. So a meniscus is a cushion in your knee that allows for stability for the knee joint, right? And sometimes as you get older, they may tear. Now, they could tear in different areas, they could tear in different parts. For specific to the meniscus, what they go in and they do is they go in and they remove the part that's a little torn. Now, when do you take that and say, hey, this is something that's surgical? Know what you want to get to, and is it restricting you? So let's say, for example, you're a runner, a long distance runner, and every time you run past 5 miles, your knee hurts and it's restricting you, right? It's affecting how you want to live your life. And that's really the big picture. Is the injury you have affecting how you want to live your life? If so, that's a checkbox in the mark for maybe potentially getting a surgery. First layer, is it affecting everything I do? Second layer, did you give it ample attention conservatively to see if it can fix it? And what do I mean by ample attention? Every injury is different. Every single body part is different. So ample attention may be a month, it may be 2 months. It may even be 3 months. And did you fully commit to it? Were you doing your exercises at home? Did you try everything in your power to prevent from getting surgery? It's very important, because sometimes people think surgery is the quick fix, but in reality, you just have to restart and still commit. So did you do everything in your power to not get surgery? If you did, then yes, it's maybe the check part. If you didn't, fully commit. Say, I'm going to do exercises every day. I'm going to do mobility every day. Do what I need to do every single day to get better. The next layer is, did you do your research, right? There's research coming out more and more now, even like an ACL tear in the knee, people are doing it non-operatively. They're not repairing ACLs, and people are coming back pretty well. So do research, or ask your PT, or ask the medical provider, hey, what is the research saying about this injury if I don't get surgery? Like, be an educated consumer, understand what's happening. That way, when you go and you fully make your decision, you're coming from a level of education rather than a level of fear, or just because somebody said, just because the doctor said. Educate yourself. And the last layer really is what you're feeling your main focus? So is that pain that you're feeling the only thing that you focus on every single day, day in, day out, right? If that pain's the only thing and you tried all the other things, you may be a candidate for surgery. So I'm a PT. I'm going to be biased to not getting surgery right away. That's always going to be my thing. I think we can help with a lot of conditions. We can prolong the effects of getting a surgery for years. I've seen years. I've seen people with knee arthritis not get surgery for years because we got them stronger, we got them more mobile, we taught them how to effectively move. So do everything you can to prevent first. Because once you go in, your body is going to be changed forever. I had my ACL torn and my knee has never been the same. Honestly, like, yes, I can function thoroughly and push it, but my knee is never the way it was once prior to surgery. So be an informed consumer. If you have specific questions, seek help. People are out there to help you, to give you their opinions. At the end of the day, you will make the decision, but those are some basic things to take into consideration when you're fully thinking about getting surgery. Hope you enjoy that. Thanks for watching.